Webinar title, Extending Medicaid to Young People in Transition from Foster Care. Webinar date, May 11th, 2023. Child Welfare Information Gateway logo and Children's Bureau logo.
Good morning. My name is Catherine Heath and I use she, her pronouns, and I'm a child welfare program specialist with the Children's Bureau here in Washington, D.C. And we are excited to have you and host you today for this early morning meeting for a few, but mid-afternoon meeting about extending Medicaid to young people in transition from foster care. So before we get started, let me just thank our presenters and panelists. We have an exciting webinar planned for you, and you're going to meet my co-host Eric Warner in a few minutes, and he's going to help me out during the second part of the webinar. But we are really excited and thankful that you're here today. So with that, next slide, please.
Slide title, Housekeeping. Bulleted items read by moderator.
So this webinar is being recorded. We will be sending out the slides, and the recording will also be posted to the CB website. We will also notify you when that happens. You have entered the webinar as an attendee and are muted, and we have enabled closed captioning. And in order to see those closed captions, please click on the CC button at the bottom of your screen. And if you have any questions following this webinar, we have posted a link to our child welfare program managers who will respond to any questions that you may have specifically about this webinar. So with that, next slide.
Slide title, Agenda. Agenda items read by moderator.
So as I mentioned before, my co-host Eric Warner and I have put together an exciting agenda. We have our introductions, housekeeping, which we have done. Then I'm going to turn it over to our commissioner, Rebecca Jones-Gaston. Then we're going to turn it over to our colleagues at the U.S. Department of Health and Human Services to talk about the provision under the Support Act, which is why you guys are all here. Then we're going to talk about the implementation recommendations that were in our recently issued Information Memorandum, and that link is going to be in our chat. And then we're going to close with Asia Schomburg giving us closing remarks. And exciting part in the middle of it, we're going to have a break and hear from the Young Invincibles, which is an amazing group of advocates who have really changed the way our country helps enroll and think through coverage for young Americans. So with that, next slide. Oh, sorry. I'm going to be introducing our commissioner, Rebecca Jones-Gaston, who came to us in December 2022 as our amazing and fearless leader. And Rebecca has been a child welfare director, most recently in Oregon. And I am really excited to hear Commissioner Rebecca Jones-Gaston really opening our webinar. So with that, I'm going to turn it over to you, Commissioner.
Thank you, Catherine. Good morning, everyone.
Rebecca is seen talking in front of a virtual background that reads, May is National Foster Care Month, and features the Children's Bureau logo and Child Welfare Information Gateway logo.
Thank you for joining us this morning and today. I am Rebecca Jones-Gaston. I use she, her pronouns. And as Catherine said, I'm the Commissioner for the Administration for Children, Youth, and Families, the federal agency that consists of both the Children's Bureau and the Family and Youth Services Bureau. I am so pleased to introduce this webinar on Medicaid access for young adults in foster care who move across state lines. At the close of our time together, you're going to have a better understanding of three important things: the new requirements of the Support Act impacting youth aging out of foster care, and their access to Medicaid that went into effect of January 1 of this year.
Rebecca is seen talking in front of a virtual background that reads, May is National Foster Care Month, and features the Children's Bureau logo and Child Welfare Information Gateway logo.
Why it is critical for child welfare agencies and advocates to help youth connect to Medicaid, and the Children's Bureau's 6 implementation recommendations to assist child welfare agencies in addressing the inequities that remain in youth accessing health coverage that they need. As you will hear from CMS, states are now required to cover young people formerly in foster care who turn 18 on or after January 1 of 2023 and who move to a new state. This is really amazing. Because of the date specified in the law, there will be young people that will not be eligible solely based on the date they turn 18. But you'll hear from both CMS and Children's Bureau that there are opportunities to cover all young people regardless of the date they turn 18. And that will make it easier for you to make sure our young people are covered by Medicaid. Covering all young people who move to your state, regardless of the date they turned 18, is an opportunity to address the disparity in this provision. For many of us, we live knowing we have health insurance. I know it's an important part of my feeling safe and comfortable for my family. We don't think about it or worry about it because we have access to healthcare that insurance provides. We also know how important it is to have health insurance. The Affordable Care Act gave young people in care this same freedom as they transition to adulthood. One less thing for them to worry about as they look to make the next step in their lives. Maintaining access has been a challenge for young people who live in a new state after aging out of care. The new provisions CMS will discuss provide us with a new ability to make this major transition in life go more smoothly. As part of this work, we can simplify the process to apply for and maintain coverage. All of us like it when it is simple to understand and apply for health insurance. It is important to think about enrollment and navigation of Medicaid from the perspective of a young person. Our young people are ready and willing to help us with this task. Our real goal is to have all eligible young people enrolled in Medicaid. Every former foster youth being able to access healthcare they need is an outcome we all want to celebrate. It's an exciting day. Rarely are we in a place where we're able to offer more benefits to young people, but today we can. At ACYF, we are committed to building collaboration across federal agencies. This includes issuing joint guidance, information, and resources focused on helping simplify the process for youth and young adults to access resource and benefits. We are excited, and I am in particularly excited to be here with our partners at CMS. This is just one of many ongoing and planned collaborative efforts to facilitate resources being available to children, youth, young adults, and families through Medicaid and other federal agencies. We know the more we collaborate, integrate, and streamline access to information about resources, the easier it is for states and communities to implement programs and services. And that directly translates into young people accessing resources and benefits that they need. This includes the use of technology and mobile-friendly information and applications, as you will hear about during the webinar today. We must support all young adults in having a successful transition to adulthood. You will hear more about this at the end of the webinar when Asia Schomburg, our Associate Commissioner of the Children's Bureau, will be talking about our exciting work moving forward. At ACYF, we listen to experts and try to listen. We're not always perfect, but we try and strive to listen to the experts. And the experts are the young people and the families, and they're telling us what they need. Youth are telling us they need strong financial resources, as well as opportunities to develop skills and access support to allow them to further their education, training, and enter adulthood. Young adults have repeatedly shared they need secure connections to loving adults who can guide them into adulthood after foster care and throughout their lives. This is one reason why hosting this webinar today is so exciting, to provide the information to agencies and individuals and how to help young people get connected and have what they need. Many of you are in positions that will be responsible for making decisions about implementation, including those that CMS recommended in the state health official letter and the Children's Bureau recommended in the IM, in the Information Memorandum. We urge you to consider implementation from the perspective of young people navigating and enrolling so it's easy to access the benefit that we all want them to have. We need to revamp the way we engage. It's important to make it easy for young people to understand the benefits and services available. And we know their caseworkers and other supportive adults are critical to them being informed in real time about Medicaid and benefits. This must be a part of our overall prevention efforts. And in closing, I just encourage you to ask questions, work to strive and do this. And I am happy at this time to turn it over to our colleagues at CMS to share more with you about the provisions of the Support Act. Thank you for joining us. Take care.
Slide text reads, Medicaid coverage of youth formerly in foster care changes under Section 1002A of the Support Act, May 11th, 2023. Several images of children and adults smiling together are below the text. Centers for Medicare and Medicaid Services logo.
Thanks, Rebecca. My name is Kate Guinness, and I am a Senior Policy Advisor for Children and Youth in the Center for Medicare and Medicaid Services. And my job, I am very fortunate that I came to CMS a few months ago, and my job is to really help CMS pay attention to the needs of children and youth and families, and have been delighted to collaborate, and I'm really happy to be here today. And thank you to our ACF colleagues for inviting us to speak today. Next slide.
Slide title, Medicaid and CHIP Today. Enrollment is at an all-time high. Figure titled National Medicaid and CHIP Enrollment, February 2020 to January 2023, CMS Performance Indicator Data, shows enrollment increase. On-screen text described by presenter.
So before we get into the details of the state health official letter that came out at the end of last year, I just wanted to bring to everyone's attention the fact that right now, Medicaid and CHIP enrollment are at an all-time high because of provisions that allowed for continuous enrollment for kids and families and adults across the country since February of 2020. So there are currently over 93 million individuals who are enrolled in Medicaid and CHIP, which is about a third increase since February of 2020. This is important because that continuous enrollment period is ending, has actually ended. And so I wanted to bring to all of your attention who are attending today, if you are someone who is enrolled in Medicaid, if you are working with folks, if you are from a state agency, everyone we hope is paying attention to making sure that those who are on Medicaid and CHIP and should continue to be so, continue to be so. And so we're just putting a little plug in, and then I'll turn things over to talk about some of the details of the former foster youth policy. Next slide, please.
Slide title, Ending the COVID-19 Continuous Enrollment Condition. On-screen text described by presenter.
So important things to know is that as of April 1st of this year, the states were able to terminate Medicaid enrollment for folks who are no longer eligible. This means that although someone might not have been eligible in the past year, they were continued in their enrollment. But there is something called redetermination. You may also hear it as the Great Unwinding. There's a lot of headlines about the Great Medicaid Unwinding. This means that states are resuming their full renewals, and they are determining whether folks still have coverage, whether they continue to have Medicaid, whether they might move into CHIP if they're a young person, or whether they might need to move and find a different plan. through the marketplace or otherwise. Today marks the end of the national emergency and the public health declarations that went with it. But the enrollment, the re-enrollment started already on April 1st. Next slide, please.
Slide title: First Unwinding Related Renewals Initiated by Month. February renewals: Arizona, Arkansas, Idaho, Iowa, New Hampshire, Ohio, South Dakota, and West Virginia. March renewals: Colorado, Connecticut, Florida, Indiana, Kansas, Mississippi, Nebraska, New Mexico, New York, Northern Mariana Islands, Oklahoma, Pennsylvania, Tennessee, Utah, Virginia, and Wyoming. April renewals: Alabama, Alaska, California, Delaware, District of Columbia, Georgia, Guam, Hawaii, Illinois, Kentucky, Louisiana, Maine, Maryland, Massachusetts, Michigan, Minnesota, Missouri, Montana, Nevada, New Jersey, North Carolina, North Dakota, Oregon, Puerto Rico, Rhode Island, South Carolina, Texas, Vermont, Washington, and Wisconsin.
So I know this is tiny. I hope people have bigger screens than I. We will be distributing the slides. But this shows states were allowed to decide anytime that they, starting in February, when they would start looking at renewals. So they would start initiating the renewals. And you can see that different states in the country started either in February or March or April of this year. Next slide, please.
Slide title: Effective date of anticipated terminations by month. April: Arizona, Arkansas, Idaho, New Hampshire, and South Dakota. May: Connecticut, Florida, Guam, Indiana, Iowa, Kansas, Nebraska, New Mexico, Northern Mariana Islands, Ohio, Oklahoma, Pennsylvania, Utah, Virginia, West Virginia, and Wyoming. June: Alabama, Alaska, Colorado, District of Columbia, Georgia, Hawaii, Kentucky, Maine, Maryland, Massachusetts, Mississippi, Montana, Nevada, New Jersey, North Dakota, Puerto Rico, Rhode Island, South Carolina, Tennessee, Vermont, Washington, and Wisconsin. July: California, Delaware, Illinois, Louisiana, Michigan, Minnesota, Missouri, New York, North Carolina, and Texas. August: Oregon.
And the effective date of the first anticipated terminations, meaning if you were found to no longer be eligible, when you might be terminated, that began in April. And the first states began it in April, and the last state to start terminating coverage will be in October. Again, what we hope is that through the redetermination process, anyone who should continue to have Medicaid or CHIP coverage continues to be covered, and that those who no longer have coverage get support moving from Medicaid or CHIP into another plan. Next slide, please.
Slide title: Preparing for the Work Ahead. On-screen text read and described by presenter.
So there's a lot of work ahead. States have been actively preparing, and CMS has been encouraging and working very closely with the states over the past year, really, to have what's called an unwinding plan, prioritizing and distributing renewals. So there is no state that is renewing everybody in 1 month. States are encouraged to use the full year that they have to renew. Some are doing it a little bit faster than that. We encourage anybody who has Medicaid or CHIP to update their contact information. Often this can be done online, but that way they make sure that they get information about redetermination. There's a huge outreach effort and communication effort happening, and I'm going to share a couple of websites from CMS, but those of you who are in different states have probably seen information that is specific to your state really being pushed out through every channel possible. We're okay with the fact that folks may hear it multiple times because we want folks to make sure that they stay covered. Obviously there's a huge volume, a larger volume than there ever has been before for states to process renewals. That's in a time when we are seeing pretty significant workforce challenges and staffing challenges across the country in Medicaid and CHIP agencies, as well as in the community-based organizations that are supporting this work. There and many people, it's been a long time since they've renewed. Some people may never have renewed if they had new Medicaid or CHIP during this time period. And so it's just a lot of work that's all happening at once. There's a lot of resources that are available to support states and partners as well as individuals. Next slide, please.
Slide title: Medicaid.gov/unwinding. Resource page for states and partners. Screenshots of the website are shown on the screen.
So this is the website, and again, these slides will be sent out for state Medicaid agencies and for partners, that has toolkits and other information and a lot of specific technical information about unwinding. I will say that the toolkit currently we're in the process at CMS of updating it, and we've to have some information specifically for youth and young adults in it, as well as for parents. So we expect the toolkit 2.0 to probably be launching pretty soon, and it will be found on this website. And next slide, please.
Slide title: Medicaid.gov/renewals. Resource page for Medicaid and CHIP enrollees. Screenshots of the website are shown on screen.
And this is for Medicaid and CHIP enrollees. If you go and you put in your zip code, it will take you to information where you can find local information about your state Medicaid agency and make sure that you can get in touch with the folks you need to. So I'm now going to hand the mic over to Sarah Lichtman-Spector, who is my colleague at CMS, and she is the director of the Division of Medicaid Eligibility Policy, and she's going to get into the details of the new policy that went into effect in January. Sarah?
Great. Thanks so much, Kate, and great to be here with all of you. You could go to the next slide, please.
Slide title: Overview of youth formerly in foster care. On-screen text read and described by presenter.
As Kate said, I'm Sarah Lichtman-Spector, the director of the Division of Medicaid Eligibility Policy at CMS. I'm so glad to be here today. I want to start with just a little bit of context setting for my presentation today, where I do promise I'm the detail person to get into it. I think you all know that over 20,000 people transition from foster care in the US each year. And as likely you also know that youth aging out of foster care can experience a range of barriers to health coverage, to access to services, which can exacerbate health disparities and social outcomes. We know that children with disabilities, Black, Hispanic, American Indian, and Alaska Native children are disproportionately represented in foster care, and amongst those, older youth aging out of foster care. At CMS, we really think about this as one of those issues, really thinking about health disparities and how to address those. Because children in foster care and aging out of foster care are much more likely to have experienced multiple adverse childhood experiences, such as witnessing violence, increasing their risk of negative health outcomes in adulthood, and youth transitioning from foster care often have a history of complex trauma and are at high risk for behavioral, emotional, and cognitive problems. Thus, as Rebecca so eloquently said, ensuring continued coverage for these individuals through Medicaid as they leave the foster care system and transition to adulthood is critical to both addressing these inequities and meeting their health needs. Next slide, please.
Slide title: Updated eligibility requirements for FFCC group. On-screen text read and described by presenter.
So this walks you through the actual eligibility requirements, moving to the actual Medicaid eligibility for former foster care children. I'm going to refer to that today as the FCC, the Former Foster Care Children Eligibility Group. So as Rebecca mentioned, in the Affordable Care Act in 2010 established an eligibility group specifically for youth who age out of foster care. And you'll see the eligibility requirements of that group on the left on this slide on the gray panel. And under the ACA requirements, a child's currently eligible for Medicaid if they are under the age of 26, not eligible or enrolled in any other mandatory group. That would be a group like qualifying as a parent or caretaker or a pregnant individual, and was in foster care in the state in which the individual is seeking Medicaid eligibility when the child turns 18 or whatever higher age the state may have elected. Some states elect up to 19 or 20, and was enrolled in Medicaid while in foster care in that state. Now you'll see the panel on the right describes the new former foster care eligibility group requirements, and these were enacted in the Support Act and came into effect on January 1 of this year, 2023, and it made two key changes. It clarified that even if the individual is eligible for another eligibility group, the individual can still be enrolled in the former foster care children's group. And two, it provides eligibility for individuals in foster care who were in that foster care in any state, and they were enrolled in Medicaid in that state. So that's the big change to the enrollment for children who were in foster care in any state. You'll see importantly in big bold letters at the bottom of this slide, there is no income or resource test for individuals eligible in the former foster care children's group. Nothing changed about that, about the Support Act. That was true in the ACA current eligibility group, and also continue to be true today. Next slide, please.
Slide title, Effective Date of Support Act Changes. On-screen text read by presenter.
Moving on to the effective date. The original eligibility requirements for the former foster care group, which is why we walk through them, related to the eligibility in another mandatory group and also when aging out from foster care in another state, continue to apply to youth formerly in foster care who turned 18 prior to January 1, 2023 of this year. So all of the new requirements I've just walked through apply exclusively to individuals who turn 18 after January 1, 2023. Right, next slide, please.
Slide title, Key Takeaways. On-screen text read by presenter.
So I want to leave you with a couple key takeaways. So states must cover the children who turn 18 on or after January 1 of this year who were enrolled in Medicaid in any state when they aged out of foster care. And for those individuals who turned 18 on or after January 2023 and were enrolled in Medicaid when they aged out of their foster care, they can be enrolled in the former foster care eligibility group, whether or not they were eligible for another group. And that these new requirements do not apply to individuals who turned 18 prior to January 1, 2023. Next slide, please.
Slide title, Considerations for Implementation. On-screen text read and described by presenter.
So state Medicaid agencies around the country will be making a number of operational modifications in order to implement these new changes under the Support Act. And they do have some flexibilities that they may make to their processes to implement it. Because some of these are state options, you may see some variation in how eligibility and enrollment is processed in your state than a colleague or somebody who's in another state. So I want to just call out a couple of these things. For example, with respect to verifications, which is an often asked question, states are permitted to accept self-attestation that an individual is somebody who was formerly in foster care, meaning that they might ask that individual on the application, and that would be completely sufficient for the state to act on, and as long as the individual was meeting their eligibility requirements, like they were a state resident. The state could also seek verification of their former foster care status, in which case some of those in foster agencies might be working, might get a query through a data call, or if you're working with a child, they might be, the state Medicaid agency might ask for a letter or some other documentation that the individual was in former foster care in another state. States are also making changes to their eligibility and enrollment systems to implement this change, and we know that sometimes that takes states a little bit of time, and are likely implementing workarounds. So states may be in a variety of places as they are implementing the changes under the Support Act. Next slide, please.
Slide title: Enrollment Pathways for the FFCC Group. Infographic showing the process for the 2 enrollment pathways is described by presenter.
Before I end, I want to talk you through what Kate was starting to touch on, which is the redetermination process. Given that those of you in agencies and in the stakeholder community working directly with former foster care individuals, want to walk you through how you may intersect with an individual and what the basic rules of the road and some options that states have for the renewals or the redeterminations. Generally, for a youth aging out of foster care who enrolled in Medicaid, state Medicaid agencies should be able to anticipate that change in circumstances, meaning they're aging out of foster care, and take steps to redetermine the eligibility for that youth and transition them to the former foster care group without requiring the individual to complete a full Medicaid application and without a break in coverage. CMS encourages states to coordinate with the child welfare agencies to identify youth who are aging out of the foster care system and leverage the 90-day child welfare transition planning process if additional information from the youth is needed to complete the redetermination process and share the Medicaid enrollment information. There are 2 enrollment pathways that you see here on this slide. For youth to be enrolled in the former foster care group, for youth who move to another state or who experience a gap in coverage after they age out of foster care, and the individual will need to complete a Medicaid application to enroll in Medicaid in the new state or re-enroll in coverage. And along the top, you can see there's a pathway of the state Medicaid agency working directly with the child welfare agency and working through that redetermination process. Along the bottom is just an individual applicant applies to the state Medicaid agency, and the state Medicaid agency goes about its redetermination. In both pathways, you'll see the state Medicaid agency has a responsibility to do annual renewals, and then ostensibly prior to the age of 26, they'll be doing a redetermination to ensure, to check whether or not the individual is still eligible, and must, prior to any termination, must check that the individual might be eligible for Medicaid on all other bases prior to termination. Next slide, please.
Resources for ensuring access and continuity of coverage for youth formerly in foster care. 3 resources are listed on screen and linked. 1. Coverage of youth formerly in foster care in Medicaid. Section 1002A of the Support Act. State Health Official Letter number 22-003, December 2022. 2. Ensuring continuity of coverage for foster youth aging out of foster care and young adults eligible for the former foster care group, September 2019. 3. Ensuring access to Medicaid coverage for former foster care youth, June 2017.
I want to end just with a note of a number of resources that we have and links that we've provided. There both are links here to the guidance letter and full slide deck that we provided to states with a lot of details about the Support Act changes. Also, a number of resources, both from 2017 and 2019, with a lot of nitty-gritty operational detail, if that interests you, to see how lots of different outreach strategies and operational resources for folks looking for interest in those types of operational details. So with that, I think I am turning it back to Catherine.
Yeah, thank you, Sarah and Kate, so much for your time today. With that, next slide.
Slide title, Summary. 2 important changes in Medicaid eligibility are: states are now required to enroll in the Medicaid FFCC category young people who aged out of foster care in another state if they turn age 18 on or after January 1st, 2023, provided they were eligible for Medicaid while in foster care and meet other applicable eligibility requirements. State Medicaid agencies can now enroll eligible young people in the FFCC group if they turn age 18 on or after January 1st, 2023, even if they're eligible for another mandatory eligibility group. This means that states can avoid the need to screen these individuals who were formerly in foster care for eligibility in all other eligibility groups prior to enrolling them in the FFCC group.
One of the opportunities in my job is to actually learn a little bit about Medicaid, and you're going to find out a little bit more about my favorite word in a little bit, but just also wanted to let you know, in summary, states are now required to enroll young people who turn age 18 on or after January 1st, 2023, they have to enroll them even if they're eligible for any other mandatory eligibility group. And this is the information that is directly from our information memorandum. So we're going to make sure you guys have a link to that, because I think this summary slide is just really helpful to make sure that everybody's on the same page. We're fortunate enough to work with CMS on this information memorandum. So we're really excited. So now we have a mid-webinar pivot. We get to hear from a group that I'm a huge fan of, the Young Invincibles. I've actually been following since the Affordable Care Act passed. So with that, I'm really excited to introduce Mina Schultz, who is a health policy and advocacy manager at the Young Invincibles. She has worked at the state, local, and now at the national level to really increase health insurance for young Americans. And I am just so thrilled to be able to hear about some of their great work. And I'm excited you're going to hear about some of the great work that they do. So with that, I'm going to turn it over to Mina. Thank you.
Thanks so much, Catherine. Good morning, everyone. I'm so honored to be here among so many passionate advocates. And I'm loving how many of y'all showed up this morning to take part in this conversation. If we go to the next slide, please.
Slide with text, Getting Covered, the Value of Health Coverage for Young Adults. Mina Schultz, Health Policy and Advocacy Manager. Facebook, fb.com/together.invincible. Twitter, @YoungInvincible.
My name is Mina Schultz. I use she, her pronouns, and I'm the Health Policy and Advocacy Manager here at Young Invincibles, where, as you heard in that intro, I work on the healthcare team to advocate for policies that will increase access and affordability of health coverage and care for young adults. I'm here to give you a little bit of a step back and some perspective on why all of this is just so dang important. Spoiler alert, young people are not actually invincible, and they have a lot to gain from access to health coverage. Next slide, please.
Slide text read by presenter. Photo of Young Invincibles group standing in front of the U.S. Capitol.
So before I dive in, if you're not familiar with Young Invincibles quite yet, we're a national nonprofit that works to lift up the voices of young people in the political process and expand economic opportunity for those young adults ages 18 to 34. YI was founded for young people by young people way back when the Affordable Care Act was in its legislative infancy in 2009. Our founders, knowing what we all know now, sought to demonstrate to decision makers that young people are not, in fact, invincible, and they value access to quality, affordable, and equitable health coverage and care. Through story sharing and advocacy, Young Invincibles mobilized young people to fight for the passage of the ACA. So from a couple of college students in a cafeteria, YI has now expanded to become a national organization, leading the charge to attain economic security for young people in issue areas ranging from mental health to student loan debt to workforce development. Next slide, please.
Slide title, Benefits for Young People. What's changed under the ACA? On-screen text read by presenter.
So to start, I'm going to give a little bit of a brief throwback here, and doing a little boasting about what's been accomplished since the passage of the Affordable Care Act in 2010. So young people do continue to be the least insured age range out of all of the age ranges out there, but their uninsured rate has been cut in half since the full implementation of the ACA, with 9 million young people able to get covered through provisions like staying on a parent's plan, enrolling on the health insurance marketplace. By the way, 4.1 million young people enrolled this last open enrollment period, which is a historic number, or through Medicaid, which includes 13% of college students gaining Medicaid coverage since implementation of the ACA. So all of these programs have made health coverage vastly more affordable for young people and guarantee them some valued healthcare services like mental health care, reproductive care, and preventive care. And then while there's still quite a bit of a way to go, the ACA has improved coverage disparities among racial groups, with a record number of Hispanic and Black Americans accessing coverage through between 2020 and 2021, or 2022, excuse me. Next slide, please.
Slide title, Young Adults Value Coverage. On-screen text read by presenter.
Okay, I'm only a couple slides in, but I think I've said it a few times already that young people are not invincible and they do value access to affordable health coverage and care. They know better than anyone that accidents happen, and even if they're healthy right now, they may not be at a moment's notice. And this became even more evident during the pandemic. Particularly mental health issues among young people were exacerbated over the last few years. The spotlight has been shown on the mental health epidemic in this age group, and efforts have since been made by young adults to better access affordable, equitable, and most importantly, culturally competent mental health care. Also incredibly important under the ACA, right? Excuse me, oh my gosh, alarm's going off here. Under the ACA, reproductive services from Pap tests to contraceptives are covered. This, along with coverage of mental health care, is a critical message to young people who are covered or thinking about their coverage options. These services are important to them, and getting and using health coverage are the first steps to accessing that essential care. Something else to consider is the number that may be astounding, but according to the CDC, about 50% of young people live with a chronic condition. These conditions range from mental health to obesity, and support and treatment for which are much more accessible when a young person has access to health insurance coverage. Other services like prescription medications and laboratory testing can also be prohibitively expensive without coverage. And then last but certainly not least, being covered means better financial stability, which is what we're all about here at Young Invincibles. Young people, from students to gig workers, are struggling. One hospital visit can put them over the edge into bankruptcy, and young adults are very, very aware of this, to the point that they'll actually live with something like a broken wrist or a broken bone for months without seeking care. And that leads me to my next point, particularly for those who have coverage through Medicaid. This is their opportunity to get care when it's most affordable. The shift to private insurance, which is common for young people as they move into the job market or move onto the health insurance marketplace, that cost shift can be shocking. All of a sudden you have, deductibles, co-pays, co-insurance, networks. What even is all that? So it's important for Medicaid enrollees to take advantage of low and no cost care while it's available to them. And part of our work at YI is to educate young adults who are new to coverage or have just never used the coverage that they have, what to do to make the most of this resource. So I've added here a couple of tips for you to review, from how to find a doctor to making the first appointment. Young people are going to need guidance with this a lot of times because it's their first time using coverage. So please, let's all encourage the young people in our lives that have Medicaid to take advantage of services right now. Next slide, please.
Slide title, Reaching Young People, Best Practices. On-screen text read by presenter. Screenshot of a Young Invincibles Virginia Instagram Reel video is shown on screen. The video is asking the question, when is open enrollment season?
So now we've got young adults eligible for services, but how do we reach them to let them know? With young people, it's most important to meet them where they are. And that can be a two-pronged approach to digital and in-person outreach. So I realize that social media is, everyone's using it, but some of those newer platforms where we find young people like Instagram and TikTok can be a little intimidating to us older folks. I know I'm not on TikTok yet. So engaging videos like TikToks and Instagram Reels are better for catching attention than maybe just an image or static copy. So example that I have here is a screenshot from an Instagram Reel that we have at YI, where we asked young people basic questions about open enrollment for health insurance coverage. By asking these questions and making it interactive, we also gained our own knowledge for the questions or misinformation that young people might have, so we can tailor our future videos. And if you scroll through Young Invincible's social media feeds, you'll see a lot of faces much younger than mine. We ensure that the stars of our posts look like the base that we're trying to reach, because young people themselves are the trusted messengers in their communities. For issues that impact young people, messaging and guidance lands better when it's coming from someone you trust within your own community. We also watch for what's trending, national events, things like the Super Bowl or the Met Gala give you really good memes. Some really good memes come out of those. You can just tailor your messages around those memes and boom, you've got some attention of young people. And then lastly, just a quick reminder, young people don't answer their phones much anymore, and they don't look at email as much as maybe we do. So text messages are probably the best way to get their attention. And then next, for in-person outreach, we take health insurance literacy on the road here at YI, tabling at community events, things that you might not even have anything to do with health insurance literacy, things like drag shows, farmers markets. Those are the parts, the places that we go to find young people. Next slide, please.
Slide text reads, Campaigns and Outreach for Young People by Young People. 2 images of Young Invincibles branded event tables and staff are shown on screen.
And then here are some photos of YI's outreach coordinators in the field. You'll see that they're heavily branded. They have quick little flyers to go to. They've got smiles on their faces. They're ready to have that conversation. And even more conspicuous, you'll see that they're young people themselves. Again, they're those trusted messengers who are out on the field having those conversations. They look like the people they're talking to. They sound like the people they're talking to. They share the same values with the people that they're talking to. And so those are the ones that young people want to talk with. Next slide, please.
Slide text reads, Mix in-person and digital outreach. A GIF and image of a Young Invincibles event are shown on screen.
And then these are just a couple of photos from our digital and our in-person work. We've got something from our National Youth Enrollment Day campaign. You'll see there's a GIF. It's not a static image. It's talking about mental health to bring people in and ask, what is this all about? And then second, we have Aisha here doing her health insurance literacy trivia, making it a little competition, and getting young people interactive in their health insurance education. And with that, thank you so much, everyone. I knew I flew through some of that, but you'll definitely have access to these slides. Thank you so much to the Children's Bureau for having us here. And I think now I'm handing it back over to Catherine Heath and her co-host, Eric Warner.
Yes, thank you so much. And now we get a real treat. We get to meet my co-host, Eric Warner, if you want to introduce yourself.
Yes, thank you, Catherine. Eric Warner, I use he, they pronouns. I am a lived experience engagement specialist with the Capacity Building Center for States.
Great, thank you so much. Next slide, please. So as you guys probably saw, next slide. I love that GIF, but.
Slide title, Implementation Recommendations. On-screen text read by presenter.
We're going to talk a little bit about the 6 implementation recommendations that were in the Information Memorandum that was issued, or IM. The first one, we're going to go through each of them really quickly, but just wanted to let you know the first one, engaging young people with lived experience as partners in this work. Then we're going to talk about working with the state Medicaid agency to really streamline Medicaid enrollment processes. really thinking through, again, what are those opportunities to support coverage for all young people? Also updating transition plan materials, foster care status verification letters, looking at websites, establishing a point of contact, and then overall thinking through how do we use this provision to really shepherd in an ability to strengthen our work across child welfare and Medicaid, with the end result making sure that our young people, our families, and young parents are getting access to health insurance. So with that, I'm going to turn it over to Eric, and happy Foster Care Month, Eric.
Likewise, happy Foster Care Month. I'm wearing my blue, dark blue, but wearing my blue nonetheless. So thank you everyone for sharing such great information. And Mina, I think some of the points that you had made earlier go right into this first implementation that we had. So if I can get the next slide, please.
On-screen text read by presenter.
Talking primarily about engaging youth and young people with lived experience in the foster care system as critical partners in this work. Mina had great points where our youth and young adults are more likely to engage in information that comes from a community that looks like them and prioritizes their needs, right? And so for me personally, this is perhaps the most important when thinking about the work that we're doing pushing this recommendation forward, is that young people will be key advocates in providing information on how to best support the implementation of this former foster care children coverage. As well, just as importantly, young people can also support their peers in not only navigating enrollment for, but the utilization of Medicaid. When we're prioritizing this need, we allow our youth and young adults to build their capacity for successful engagement and really some difficult systems to really understand and access. Next slide, please.
On-screen text read by presenter.
So this is where I come back in, is thinking really through working with the state Medicaid agency to streamline that Medicaid enrollment process. I think we heard at the beginning of the webinar how important it is to actually think through who's applying for the benefit and how do we really think through streamlining this. And with any new provision, this is really an opportunity for us to take a step back and think about the entire application process and system for not just the referral, but the enrollment and re-enrollment of young people under this category. You know, if you've read the state health official letter like I have, you see that it really reiterates that CMS is really committed to simplifying the enrollment process for everybody. And this makes it really easy for our young adults, and really thinking through, again, how are we thinking through mobile technology as the ability to really think through allowing people to access this benefit. And, you know, I talked a little earlier about how I get to dabble now in some Medicaid information, and I learned a favorite new word, which is self-attestation. And I'm going to turn it over to Eric to talk a little bit more about my favorite word.
I love that. So yeah, really, it was mentioned earlier in the state health official letter, but CMS encouraged the states to accept self-attestation of former foster care and or Medicaid enrollment status, particularly for young adults who were enrolled in Medicaid in another state, while also in foster care at the time that they aged out. Some states have already implemented this, and from a young person's point of view, this approach to verifying foster care status is most likely to be seen as the least burdensome and invasive way to enroll a young person, while also giving them the confidence that they need to access this coverage. And so I'll pass it back over to Catherine, unless you have another point on your favorite word there.
Yeah, and just, you know, how trauma informed it is when we make sure that we can accept that self-attestation, as opposed to a young person having to prove their foster care status, and any delay that may then cause when we have to verify that. So I do think that this is one of those most incredible opportunities. And I do hear from many states how much it simplifies their process when they accept self-attestation. So you can see now why I like this word, and I'm glad I learned it. So I'm going to talk a little bit on the next slide about
on-screen text read by presenter.
Our ability to support coverage for all young people. I think you heard from our commissioner about the importance of this. And, you know, basically based on a date of birth, you are either eligible for a benefit or not. And we know that for our young people, That means it's really difficult to navigate. And we also know that they realize how inequitable that is. And in the CMS letter, we provide the CMS letter, and then in our information memorandum, we provided information about how state Medicaid agencies could go about making sure to cover all young people. Simple for them, simple for us, simple for everybody involved, including our end providers, and really thinking through, again, how do we make sure that we enroll young people in this benefit?
On-screen text read by presenter.
And, there's the section 1115 demonstration waiver, another word that I have come to love and learn about through my work. And it really does allow us that opportunity to provide that equitable service. So with that, I'm going to turn it over to Eric to talk about what I think are some of the key parts that we can actually act on.
Thank you, Catherine. And I think here I might just slow us down a slight bit, because this is going to be some really important information that we want to make sure that all people understand and are engaging with. But for update, next slide, please. I apologize.
On-screen text read by presenter.
So we're moving into updating transition plan materials in a foster care status verification letter. And primarily, we want to break this down into 3 recommendations for this part here. 1, that the child welfare agencies need to review all the transition plan materials to update them in accordance to the new medical eligibility requirements. And a little further on that note, that federal law is requiring that child welfare agencies provide any official documentation that's necessary to prove the former foster care status for young adults who are aging out of care. Also, the Children's Bureau recommends that child welfare agencies review the state's verification letter or document to ensure that it clearly identifies the young person's eligibility for this FFCC Medicaid benefit, and that it's providing an agency point of contact to respond to with questions. So allowing this action is really going to empower the young person to move to a state with the information that they need and the confidence to engage in those strategies, which again is going to help alleviate the workload of all of us involved in this process, while also building the capacity of our youth and young adults to transition to a successful adulthood. And then finally, the Children's Bureau is also going to encourage child welfare agencies to invest in digital solutions and portals, including mobile applications, which are specifically designed for use on smartphones and tablets. This, as we heard Mina say, is going to probably primarily be the best way for youth and young adults to access not only the information they need to get benefits, but also to enroll into those benefits and keep up to date with all that access information. And I'll move us kind of in tandem to our next slide and next
on-screen text read by presenter.
Implementation recommendation, which is updating the websites and establishing a point of contact and also promoting awareness. More specifically, when we're talking about this, child welfare agencies need to review their websites and update information related to the FFCC group, including the information on whether the agency is covering young people who turned 18 and the foster care system date. We're also looking to have links to applications and other resources to assist, just have that awareness of how they can access these services, and continue to include information for who they can contact if they have any questions as well. The Children's Bureau is encouraging child welfare agencies to designate a contact to manage all the requests for verification of eligibility for young people in coordination with the state Medicaid agency, which is going to help streamline the process for youth and young adults trying to get that information for themselves. And then states, and perhaps importantly for this point, should reach out to their tribal partners to ensure that eligible youth in or aging out of foster care under the jurisdiction of a tribe are aware of this benefit. States and tribes should partner together to determine how. And then finally, to increase the awareness of this new eligibility change, the agency should reach out to the legal and judicial community, foster care alumni organizations, and other community partners. It does take a village in this sense, and so we are not alone in this work to move it forward. And with that being said, I will pass it over to Catherine.
Great, thank you, Eric. Just wanted to really think about what you said and how we can proactively provide young people with this information, right? Not at the time when they're deciding whether they need to go to the doctor or not, but again, we know they're moving across state lines. When we have that, the ability to actually provide that information in advance and work to have them enrolled before they even, as they're considering moving across state lines. So thank you so much for that. Next slide, please.
On-screen text read by presenter.
And finally, this is, for us in many ways, we are really thinking through how this is just the beginning of continuing to strengthen our collaboration between child welfare agencies and Medicaid agencies to promote the health of all children and youth and their families in the transition from foster care. I think the statement is that in about a year, child welfare agencies are going to have to submit to us a new 5-year plan that will have a healthcare oversight and coordination plan. And this is a perfect opportunity to start doing this work together and to continue it. And Eric, I know you went out a little bit, so I'm just going to reiterate that you talked about the importance of websites, which I think is really important, the materials and updating them. And you know who you can pay to do that? Your young people. Your young people are the best at visual graphics, understanding the type of information that you're trying to provide. So, what a great paid opportunity for them to help you implement this provision. So I'm going to turn it back over to you, Eric. Thank you for being such a great co-host.
Beautiful, and I apologize for any technological issues, everyone. With this point, I would like to turn it over to our Associate Commissioner Schaumburg, who joined the Biden administration in March of 2021. And we are so thrilled and so fortunate to have such a staunch advocate in this space. So without further ado, Associate Commissioner Schaumburg, please feel free to introduce yourself here.
Associate Commissioner Schaumburg is seen talking in front of a virtual background that has the Administration for Children and Families logo.
Thank you, Eric, and thank you, Catherine, and thank you to our partners at CMS, not only for the opportunity to co-host this webinar together, but for thinking about young people impacted by foster care, for hearing what they need, and for responding to what they need. This is a very important development in how we support young people. I co-hosted a town hall yesterday with Think of Us and our partners at CMS, SAMHSA, which is our Substance Abuse and Mental Health Services Administration, and HUD, which is our federal housing agency. And we focus on the importance of responding to what young people say they need and responding in a collaborative interagency way. So this new rule is a very real example of how well-being of young adults, particularly impacted by foster care, requires strong partnerships. At the Children's Bureau, we have 4 priority goals. The first is all about prevention. The second is about supporting caregivers. And the third is about ensuring youth and young adults leave foster care with strengthened relationships, holistic supports, and opportunities. The fourth goal is about supporting the workforce. Now, today's webinar is all about goal 3, ensuring youth have what they need, and health insurance is a top priority for all of us. In February, the Children's Bureau and Think of Us convened a young adult ambassadors from all over the country to talk to us about what was most important, and health and mental health were among the top 3 most important needs that were identified. Now imagine trying to move into successful adulthood without health insurance. We heard Mina say that even with the gains made under the Affordable Care Act, young adults are still the least insured group. And we heard her say that 50% of young adults are living with a chronic condition. I want to encourage you, let me rephrase that. I want to ask you to convene young people impacted by foster care in your jurisdictions, even in your regions, to ask, we may want to make sure that young adults and professionals as well know about this very important change. Young people are the messengers. We also heard Mina say, messaging works best when it comes from their peers, someone they trust. And while you're working on that, you can also ask what else is important and what can we do to support transition age young adults. I want to ask you not to try to solve all these problems in your own quote, system or agency, but to implement an interagency approach to go as far as you can to support transitioning young adults. In this case, consider launching a work group series that includes child welfare and CMS partners and maybe others. If you're not sure how to get to a place of covering all young people, create a list of what you think the barriers might be and use your work group to tackle those barriers. Be a champion and find other champions. I want to thank the Young Invincibles who are modeling championship for us. Now reach us at the Children's Bureau if we can be helpful, because we want to be supportive. That's why we're here. We heard the commissioner say, let's simplify the process. And I'll go with Catherine's favorite word, self-attestation. Let's accept the young person's word as proof they were in care. Let's have trust. Update the transition plans, review the information and ask questions, update the website, use technology. This is how we increase access to enrollment. Some young people have told me, I didn't even know that they had access to a particular benefit. Some of us have to get with the times. Let's cover all young people, regardless of the date they turn 18. Thank you all. Thank you for being a part of this webinar and for listening to us today.
Thank you very much, Associate Commissioner Schaumburg.
Eric Warner is seen talking in front of a blurred background.
And thank you all for coming today, for listening to this incredible work that's being done. And we look forward to making sure that all youth and young adults are available and have access to Medicaid as they are able. With that, we will send all this information out to you appropriately, and we look together to further this work. With that, I think we are going to end the webinar. Thank you, everybody.